Welcome to The Explainer. Today, we're going to talk about a medication called Fosinopril. You might also know it by its brand name, Monopril.
So, have you or maybe someone you care about recently been prescribed a new medication for high blood pressure or heart failure? If so, you've probably got some questions, and that's completely normal.
And that's exactly why we're here. In this explainer, we're going to break down what you really need to know about Fosinopril, what it is, how it actually works, and most importantly, how to use it safely. And just so you know, all this info comes straight from the official literature.
All right, let's dive right in. First things first, what is Fosinopril? Okay, so Fosinopril belongs to a group of medicines called ACE inhibitors. Now, doctors usually prescribe it for two main reasons. High blood pressure, you might hear it called hypertension, and heart failure. It's not a quick fix, it's designed as a long-term treatment to help you manage these conditions over time. Okay, now for the really cool part. How does this stuff actually work in your body? It's actually a pretty clever process that can make a huge difference for your heart and your blood vessels.
So, to get how Fosinopril works, we have to look at your body's own system for controlling blood pressure. It's kind of like a domino effect. It all starts with your kidneys, and after a few steps, your body produces something called angiotensin II. Now, the main job of angiotensin II is to squeeze or constrict your blood vessels, which in turn raises your blood pressure.
And this is where Fosinopril comes into play. It basically jumps in and interrupts that domino effect. It blocks the specific enzyme, the ACE enzyme, that's needed to make angiotensin II. So no enzyme, much less of that problematic angiotensin II. Simple as that.
And this really shows you the difference it makes, a real before and after picture. Before Fosinopril, you've got those tight, constricted blood vessels, and your heart is just working overtime, really straining to pump blood. But then, after Fosinopril gets to work, look at that. The blood vessels relax, they open up, and suddenly blood can flow much more freely. That lowers your blood pressure and, just as important, it takes a huge load off your heart.
All right, so we've covered the how it works part. Now let's get practical and talk about dosage and how to actually take it correctly.
If you're taking it for high blood pressure, a typical starting dose is 10 milligrams, taken once a day. Think of it as a starting point. Your doctor will then see how you respond and might adjust it from there. Now, for heart failure, the approach is usually a little more cautious. The initial dose is often a bit lower, say 5 to 10 milligrams, and your doctor will want to start you on it under close medical supervision, just to make sure everything's going smoothly.
Okay, so here are a few really important tips for taking this medicine. First, consistency is key. Try to take it at the same time every single day. Second, especially when you're just starting, you might feel a bit dizzy or lightheaded, so just be careful when you stand up. Take it slow. Third, make sure you stay hydrated. That's always a good idea. And of course, the absolute #1 rule, always follow your doctor's directions. Don't ever change your dose without talking to them first. All right, let's talk about side effects. Like pretty much any medicine out there, Fosinopril can have them. It's really important to know what to watch for, both the more common things and the more serious ones. But before we dive in, I want to share this quote from the patient information leaflet. It says, "Do not be alarmed." And that's key. The point here is to be aware, not to worry. A lot of people take this medication and feel totally fine. So the most common side effects are usually pretty mild. You might have heard about the ACE inhibitor cough. It's a dry, nagging cough that's kind of a signature side effect for this whole class of drugs. You might also feel a little dizzy or get a headache, which often happens as your body adjusts to having lower blood pressure. Okay, and we need to talk about the serious stuff. These are much rarer, but you absolutely need to know about them. Things like swelling of your face, lips, or throat, that's called angioedema, or any difficulty breathing. Other major red flags are yellowing of your skin or eyes, or if you notice you're barely urinating. If any of these happen, don't wait. You need to contact your doctor immediately.
Okay, we're on to our final section, and this is probably the most critical part. We're going to cover some really important warnings and potential interactions that you absolutely have to be aware of.
And this is the big one. I really want to emphasize this. You cannot take Fosinopril if you are pregnant. It can cause serious injury or even death to a developing fetus. So if you are pregnant, or if you're even thinking about becoming pregnant, this medication is a definite no-go. Please, it's so important to talk to your doctor about this right away.
Fosinopril can also interact with other common drugs and even supplements. For example, if you're taking potassium supplements or using those salt substitutes that are high in potassium, it could push your potassium levels way too high.
And get this, even something as common as ibuprofen can make Fosinopril less effective and could increase the risk of kidney problems. This is exactly why it is so vital to tell your doctor and pharmacist about everything you take. And I mean everything: prescriptions, over-the-counter stuff, vitamins, supplements, you name it.
So, when you put it all together, what's the main takeaway? Well, Fosinopril is a really powerful tool for managing heart health. It can be a game changer. But it's not something you just take. It really requires teamwork between you and your healthcare provider. Open communication is everything.
And that really brings me to a final question for you. Now that you have all this information, what's the one thing that stands out? What's the most important thing you're going to discuss with your doctor about Fosinopril? Because at the end of the day, being an informed, active partner in your own healthcare is the absolute best way to make sure your treatment works for you.